All right, let's go ahead and get started. I'm sure people will trickle in, but I do have a few housekeeping things before we get started. So welcome everyone. I'm really excited to be presenting this to you today on intuitive eating for metabolic disorders with Stephanie, who is our metabolics expert. So just before we get started, this will be recorded and I'll make it available to all of you afterwards. You will be getting one CEU for the presentation, which I'll be emailing to all the attendees after the presentation. I'll also be sending a copy of the slides, which will have the reference list. So you should have all your materials. I'll send it all out after. Throughout the presentation, we will be I'll kind of be monitoring the Q&A box and the chat box. Feel free to type your questions in the Q&A box if you can. We will do our best to answer them at the end of the presentation. If we don't get to your question, we'll definitely try to cover it via email afterwards. And with that, I'm going to be presenting first, and then we're going to turn it over to Stephanie. So ask your questions throughout the presentation, and we'll get to them at the end. Okay, I'm actually going to my Wi-Fi can be a little weird, so I'm going to stop my video for right now. So just to introduce ourselves, I'm a New York City-based registered dietitian and the nutrition services manager at Dr. Shar USA, which makes Shar gluten-free foods and flavous low-protein foods for people with inborn errors of metabolism. I have a lot of experience giving presentations like these, and I spend a lot of my time at Dr. Shar developing educational opportunities for dietitians and other healthcare providers. So we do a lot of webinars, teaching tools, recipes, journal clubs. All of that is pretty much on our Dr. Shar Institute, which I'll share with you after the presentation, the link to that. My specialties are in gastrointestinal disorders and kidney disease, but I'm really excited to be presenting with Stephanie today. I have a personal connection to PKU in the metabolics community. My sister-in-law has it, so really, I really love working with this group of dietitians. It's so important what you do. My contact information is on this slide. And feel free to reach out to me with any questions you have about Flavis Foods or any of our other education programs. I'm always looking to expand our education programs, particularly for this community of dietitians. So feel free to reach out with any suggestions or anything you'd like to see us do at Dr. Shar. With that, I'm going to introduce my co-presenter, Stephanie Hacker. Stephanie is the metabolic dietitian and newborn screen program manager for the Dr. John T. McDonald Foundation Department of Human Genetics at the University of Miami Miller School of Medicine in Miami, Florida. Stephanie has treated over 70 patients with PKU, working closely with them from birth into adulthood to ensure they are receiving optimal nutrition and health. She's a proponent for nutrition and rare disease education, and she leads lessons for medical and graduate students in several statewide initiatives to increase newborn screen support. Stephanie is, she serves on various advisory councils for PKU and other metabolic disorders. In addition to working in genetics, Stephanie is passionate about fitness and wellness. She has worked as a group fitness instructor and personal trainer for over 10 years, and she encourages her patients to lead a healthy lifestyle and has been an advocate of increasing the wellness of her patients and the metabolic community. Stephanie graduated from the University of Florida with a Master of Science in Food Science and Human Nutrition and a Bachelor of Science in Nutritional Science and a Bachelor of Science in Applied Physiology and Kinesiology. Okay, here are learning objectives for your CEU logging. And this is a brief outline. So we're going to introduce intuitive eating, what it is, the science behind it. We're going to talk about the biology of weight management and the evidence for using intuitive eating in disease management. Then we'll go into some of the nitty-gritty, the 10 principles of intuitive eating, the use of it in this population, metabolics population, and we'll do a Q&A at the end. So before we hop into what intuitive eating is, I want us to take a moment to think about the way we eat today in the US. What I'm seeing with a lot of clients, patients, even on social media, and in speaking to other RDs, is that we all really typically eat while doing other things in the US. Breakfast tends to happen as you run off to work. Maybe you grab a protein bar, a smoothie. Lunch, then, you're in front of your computer while you're answering emails. Then a lot of us like to unwind with dinner in front of the TV. And this is fine, but it's a common theme we see here. And the result is that we're no longer paying attention to our food. This is a stark difference in American culture compared to other countries. One in particular that I'm very involved in is Italy. My company is an Italian company, so I get the opportunity to experience their culture pretty often. And in Italy, they're eating, pasta, white carbs that are so feared in America for most meals. But despite what they're eating, they're metabolically healthier than the US. So what's happening there? The stark difference is the way that they're eating. They're sitting down for meal times, enjoying their food. In our headquarters, for example, they clock out for a full hour during lunch and they actually sit down to enjoy it with their coworkers. They're taking a break and they're monotasking, something that rarely occurs for us in the US. So the question is, what are the potential problems with the way we eat today? And first, we want to talk about hunger and fullness cues. A lot of times, you eat according to the clock versus when you start to feel your stomach grumbling. So the clock says 12:30, okay, time to eat, or 4 p.m., I guess it means I need a snack. So we let societal standards guide most of our meals rather than using our own internal cues. The other thing is that we're distracted. So when we're distracted, we don't pay attention to the food that's going in. And by doing so, we may not realize that we're eating more than we need to satisfy us. Um, this is really a problem, and specifically in the United States, but in a lot of Western countries. And a recent study actually found that using social media, specifically smartphones, during meals led to a 15% increase in calories during that meal. So what happens when we overeat? We tend to gain weight. We tend to be less metabolically healthy. And what is our response? The yo-yo dieting and diet culture. So we're going to talk about why diets don't work, but also helping patients adapt to a more intuitive approach to eating and all of that, all of what that involves. And it's not necessarily just focusing on what the food is, it's how we eat. So it's important to understand why weight loss diets do not work. And first, I want you to think about our hunter-gatherer ancestors. They didn't know when their next meal was coming. And so at that time, it was advantageous to be able to maintain weight. And as a result of this, our bodies adapted to hold on to fuel. And while this was beneficial in the past, it works against people when it comes to, maintaining healthy weight. So when you go through a phase of a strict restriction, and that's most weight loss diets, the hunger fullness hormones actually change. We have decreased leptin, which tells us when we are full, and increased ghrelin, which tells us when we are hungry. Therefore, shifting to a constant state of hunger to maintain weight loss, individuals must adhere to behaviors that counteract physiological adaptations and other factors favoring weight gain. Additionally, weight cycling and weight loss diets tend to be a quick fix to a long-term problem. Instead of meeting you where you are at, they are one size fits all. The issue is when you adapt to a diet plan that isn't aligned with your long-term lifestyle, the benefits will be as fleeting as you following it. So for example, while keto may help you shed weight initially, if you regain all the weight when you go back to eating normal foods, then keto never really worked for you in the first place. Learning how to adapt healthy habits for life is key to maintaining health. And not only are these diets helping you adapt to healthy, sustainable habits, but they may be promoting, unhealthy, unsustainable habits. They're maybe promoting disordered eating habits as well. So research shows that a history of dieting is a key predictor in future disordered eating. And one reason why diet culture is so successful in keeping people around is that the nature of it keeps you on a hamster wheel, known as the restriction binge cycle, as you see in this image here. Diets encourage you to restrict your food, which then lead to increased cravings, as I mentioned before. So what happens when cravings get to be too much? We tend to binge on them. Then, there's this whole guilt cycle, and then you try another diet, and it's just a cycle that keeps on perpetuating. So these diets are keeping you around and also making you feel like you're failing. And research has found that a history of dieting significantly predicted future weight gain. For example, 15 of the 20 comparisons, there's a review article that examined the measures of dieting significantly and showed that it predicted future weight gain. And this is all over the literature, and it's in the Intuitive Eating book, which I'll show you shortly. Yo-yo dieting can also cause detrimental metabolic effects. So when you lose weight, even modest amounts of weight, it can cause shifts in plasma lipids, blood pressure, fasting glucose, and insulin concentrations. So, even with a mild degree of weight gain after going through these yo-yo dieting cycles, eventually you're going to go back, your body's going to revert back to baseline or beyond. So these are things that we're talking about intuitive eating, and I'll show you it's not about weight loss, but a lot of times people get into these cycles and they can't get out. So really trying to make our patients healthier here is the goal, and these restrictive diets aren't the answer. So what is intuitive eating? It's an approach that was created by two registered dietitians, Evelyn Tribole and Elise Reich, in 1995. The approach is detailed in their book, Intuitive Eating, which is now in its 4th edition. And basically, it's a non-diet approach to health and wellness that helps you tune into your body's signals, break the cycle of chronic dieting, and heal your relationship with food. It's a framework that helps us keep nutrition interventions behavior focused instead of restrictive or rule focused. It's about being present in the eating experience in a non-judgmental way. It's a broader framework that goes outside the eating experience, encouraging people to actively reject external diet messaging and change their relationship with food and their body. So for those of you who have not had the opportunity to read this book, I highly encourage it. It's definitely a trending topic in our field right now, and it's a great read even if you're just looking at your own eating habits. But I learned a lot personally in how I can help clients and patients and how I can help myself eat a little better. So, and it's important to note that it rejects diet culture, food rules, and weight bias. So this is your brain, and this is an image that I really liked. It was referenced in the Intuitive Eating book. It's based on Dr. Paul D. McLean's triune brain model, which is based on the division of the human brain into 3 distinct regions. So this is explained throughout the Intuitive Eating book, and the 3 areas are based on an evolutionary view of brain development. Intuitive eating embraces all 3 of parts of the human brain: the reptilian, the limbic, and the rational. In infancy and toddler years, eating is mostly instinctual, so that's your reptilian brain function. As we grow older, thoughts and feelings play a larger role in eating decisions. Our bodies are not just tongue and stomach at this point, but also mind. So eating intuitively is not eating whatever you want, whenever you want. So yes, you have the freedom to do this, but it's really about understanding what satisfaction really is and eating in tune with your body's satiety cues. Eating whenever you feel like it may, without regard to hunger and fullness, will likely not be satisfying to your body, and it might actually cause your body discomfort. So you're really focusing on honoring your body with intuitive eating, and your brain is part of your body. So it's really a critical point. And before we get into the 10 principles in Stephanie's portion of the presentation, I do want to briefly mention some other non-diet approaches that come up and are often incorrectly used interchangeably with intuitive eating. So the first is health at every size, which is really growing in popularity in many spaces, and I think it comes up a lot in our fields. The approach argues that one can be healthy regardless of weight and often addresses prejudice against people with larger body sizes, particularly in healthcare. Intuitive eating, in contrast, usually omits discussion of body weight or whether attaining a normal weight is one of its goals. And so in the newer version of the book, the authors try to address this and include a little bit more of this conversation, but this is really not the goal of the intuitive eating program. On the other hand, mindful eating is something else that comes up a lot. It involves tuning into your body's cues and having a full awareness of the entire eating experience. So mindful eating is a process of paying attention on purpose to your actual eating experience without judgment. And intuitive eating is obviously a very fundamental component of mindful eating, but it's more broad in its approach. It's not only focused on eating, but it includes components of broader wellness, such as physical activity. It's a really nuanced difference, and I like to talk about a quote by Evelyn Tribole, one of the intuitive eating authors, because I think it explains it well. So she says, mindful eating is a process of paying attention on purpose to your actual eating experience. I consider intuitive eating a broader philosophy, which includes physical activity for the sake of feeling good, rejecting the diet mentality, using nutrition information without judgment, and respecting your body regardless of how you feel about its shape. So it's possible to engage in mindful eating without becoming an intuitive eater, but I don't think intuitive eating is possible without mindfulness. So that's the key difference there. And here are the 10 principles which are outlined in the Intuitive Eating book, and they each have their own chapter in the book, so you can get really detailed. Stephanie is going to talk about each of them more deeply, but I do want to just quickly mention them here. So they are: reject the diet mentality, honor your hunger, make peace with food, challenge the food police, respect your fullness, discover the satisfaction factor, cope with emotions with kindness, respect your body, exercise, feel the difference, and honor your health with gentle nutrition. Um, I, I am going to talk a little bit about, quickly some studies that address intuitive eating and chronic disease management. So there is some evidence for using intuitive eating in chronic disease. This is a Brazilian observational study that looked at intuitive eating and diabetes management. A total of 179 individuals, mostly female and elderly, were predominantly taking oral anti-diabetic drugs without insulin. This was the population. The researchers assessed intuitive eating by an intuitive eating scale called the IES-2. And the scale is made up of questions on eating attitudes involving intuitive eating. So it looks at total score, which is generated from an average of all of the questions. And then they address other components like unconditional permission to eat a desired food when hungry, classifying the food as neutral, and eating for physical and non-emotional responses, reliance on hunger to determine when and how much to eat, and congruence in food choices. So I just put them like a little key here because they do put them in this table. So the authors observed that participants with inadequate glycemic control had longer type 2 diabetes duration and treatment and were taking oral anti-diabetic drugs in association with insulin. These participants also self-rated their health status as regular or poor, and that was significant. But participants with adequate glycemic control had higher scores on the intuitive eating scale, particularly for the reliance on hunger to determine when and how much to eat, and the allowing good body nutrition subscales. There weren't any statistically significant differences in A1C levels according to the other parameters, including BMI. But from this, the authors concluded that eating intuitively, especially in accordance with body needs, may be associated with lower chances of type 2 diabetics having poor glycemic control. This is another study that looked at intuitive eating during and after pregnancy with metabolic health at 1 year postpartum. So these women they had gestational diabetes or high-risk gestational diabetes. This is another observational study out of France, and it looked at the same intuitive eating questionnaire in 117 women. The researchers found that there was an association between intuitive eating during and after pregnancy with lower BMI, weight retention, fasting glucose, and A1C at 1 year postpartum in women with gestational diabetes and those who are high risk for it. This suggests that intuitive eating could be an effective intervention for weight and glucose control in women with gestational diabetes postpartum. And the last study I'm going to reference is a French study, again, that looked at intuitive eating and weight loss post-bariatric surgery. Just as a disclaimer, I am fully aware that the authors of intuitive eating would probably cringe at this idea of it being used for a weight loss surgery. But I think it's important to mention, as individuals who are post-bariatric surgery do have altered anatomy and will always be in some sort of chronic disease maintenance state. So this was a cross-sectional study that used a self-administered questionnaire and targeted women who had undergone bariatric surgery. Intuitive eating was again assessed with that same IES-2 questionnaire. And the surgical procedures varied. So most of the participants had the adjustable gastric band or sleeve gastrectomy, and around 40% had undergone gastric bypass. So important to note the vast majority of participants had undergone the surgery in the past 3 years, so they were fairly new in their post-recovery life. So they found that the association between total IES-2 score and the relative change in BMI was significant, with a relative BMI loss of 2.6% for each 1 point increase in the IES-2 score after adjusting for elapsed time since surgery and type of surgery. And that's on this table here. The authors then did a multivariate analysis where they replaced the total IES-2 score by the 3 subscores, so those same ones we were mentioning before, and only eating for physical rather than emotional reasons remained significantly associated with relative BMI change. So that's an interesting fact that that's really the eating for physical rather than emotional reasons was the one that was changed the most. So basically, eating behaviors changed with increasing time since surgery, and the authors concluded that an intuitive nutritional approach may be complementary to with bariatric surgery post-op counseling. One important limitation in the study is that no food intake was assessed, so it's unclear whether people with higher intuitive eating scores adhered to post-bariatric guidelines better, or if they adopted healthier eating habits, or they exercised more, and none of that was really assessed. But again, intuitive eating is not focused on weight status or weight loss, so while this education might be really beneficial for post-op counseling in bariatric surgery patients, and it might help them have a healthier relationship with eating and food, I think it's kind of a fine line whether or not this is really something that should be looked at in association with weight loss. Okay, so now I'm going to turn it over to Stephanie. So,
thank you, Megan. Thank you for the introduction and for some of the science behind intuitive eating. Most of you know me. I looked at the participant list. And so I just want to point out, before we start talking about the principles of intuitive eating and applying them to a restricted patient or patients with inborn errors of metabolism, I'm sure we're all aware that there is very limited research in patients with inborn errors of metabolism and weight loss and intuitive eating with that in general. But a background on me, obviously I'm very into wellness and fitness, and I've been really passionate about improving the wellness of my patients, and with that, improving their relationship with food. I have found that kind of since starting in metabolics over 6 years ago, that a lot of my patients have had kind of distorted relationships with food, which is to be expected with the diets that we prescribe. But I've really worked to help patients have healthier relationships, again, with food and also with their bodies. And that's kind of where I've used intuitive eating to, again, promote overall wellness in patients. And so I hope that you guys can take away some principles so that when you guys go back to your clinics and your patients, that you can apply these principles so that, again, we can really improve the overall, I hate using the term wellness again, but the overall health of our patients with inborn errors of metabolism despite their food restrictions. So again, take that away, like make that your takeaway. I have, just so that you guys are aware, with a few PKU patients that are adults, I have been able to kind of use these principles directly to help them with their relationships with food. Again, I have 3 adult women that when I first started working with them, I definitely noticed that they had, in addition to controlling their PKU, they had very disordered eating behaviors, almost on the verge of a diagnosed eating disorder. So in addition to kind of referring them to therapy, we did use intuitive eating to help improve, again, their relationship with food and their relationship with their bodies. But again, no certifiable research. This is all kind of just clinical experience. If there are any research heavy dietitians on the call and you guys would like to do research, I would love to collaborate. But I am not research heavy. I just kind of try things with patients and see what works. So with that being said, as we talk about the principles, wait a one, Megan, I think I messed up. Let me see if I can go back to, okay, let me see if, okay. So when I talk about the principles of intuitive eating, something that does need to be mentioned is that intuitive eating is a privilege, in that to successfully intuitively eat, a patient or an individual must have food security. So if a patient is food insecure or doesn't have access to food, intuitive eating can't really be successfully employed as a treatment strategy or as a counseling strategy, because meeting these principles is really difficult if a patient isn't sure where their next meal is coming from. So just something to keep in mind. And with that, I'm going to go into each of the principles. Please, again, keep in mind that I'm going to explain the principles kind of from an overall nutrition standpoint, and then I'll put in some caveats in the treatment of inborn errors of metabolism. The last slide, or one of the last slides, I kind of outlined all of the intuitive eating principles in relation to inborn errors of metabolism, but I may not touch on the treatment of inborn errors of metabolism for each principle. So also keep that in mind. So the first principle is rejecting the diet mentality. And as metabolic dietitians, this may freak us out and say, oh my God, how could Stephanie be saying to reject the diets? We write diets all the time. This principle is not referring to rejecting a metabolic diet or rejecting any sort of clinical diet. Like if a patient has an allergy to peanuts, the intuitive eating mentality is not saying that a patient should eat peanuts. The rejecting the diet mentality really comes from rejecting diet culture as it is presented in the society that we live. And that is really the promotion of this thin ideal and this cycle of weight loss that Meghan explained in that binge eating disorder. And this quote on the page by Christy Harrison, who is an intuitive eating counselor. She has some great podcasts about a great podcast about intuitive eating, which I have on a reference slide at the end. But she says that diet culture is a system of beliefs that worships thinness and equates it to health and moral virtue, which means you can spend your whole life thinking you're imperably broken just because you don't look like the impossibly thin ideal. And we see this diet culture on magazine covers, in movies, in the news. Every time we open social media and you see a thin influencer, and this diet culture is the first principle, because to successfully intuitively eat, you really have to recognize that all of this pushing of food in mainstream media is not necessarily right. And again, in reference to IEMs, this is not rejecting treatment diets. It's rejecting diet culture. And just to also point out, diet culture affects our patients just as it does everyone else in society, as it does ourselves individually. And it even compounds the treatments of eating disorders, because we often will have patients that will start a quote unquote weight loss diet and not inform us about it because that's what their friends are doing and they want to be part of the crowd, or that they've been influenced by something in the media, or a desire to lose weight. And these weight loss endeavors that are pushed through diet culture can then also impact their management of their inborn error of metabolism. So again, first principle, rejecting diet mentality in reference to diet culture, not in medically treated diets. The next principle is honoring your hunger. And this is really important because to be able to intuitively eat, you have to recognize when you are hungry and trust your body that there will be food available, or that when you trust your body that when your body says that you're hungry, you should eat. So there's two schools of hunger. One is physical hunger, which is actually feeling hungry, which is kind of the sensation that we need to eat. The intuitive eating thought is that if you really start feeling any of these symptoms of physical hunger, you may have gone too long without eating, which then may cause you to not be able to eat to satisfaction. You may go beyond that point of satisfaction and feel overly full. The other school of hunger, the other way that we feel hungry, is psychological hunger. And that's kind of when we think about food, or we maybe see food, like you're at a bakery and you see a cookie. Maybe you weren't hungry for the cookie, but you saw the cookie and you decided you wanted to eat it. Or maybe you all of a sudden have a craving for like for French fries. And so you decide, okay, well, that's what I'm really craving. I want French fries, even though I might have eaten an hour ago. This is what my body is telling me that I really want. And so again, psychological hunger is kind of something that is a craving or a desire to eat that may be outside of our physical needs. And part of intuitive eating is recognizing that we get cravings. That's a normal thing to happen, and to respect those cravings, which we'll kind of talk about in the next principle, which is making peace with food. On the right side of the screen, you can see this hunger scale. And this is useful in intuitive eating. As I kind of said, if we let physical hunger run rampant, we'll likely overeat. And so overshoot our satisfaction. And then that may make us not feel great and cause us to not have the best response to honoring our bodies. So in intuitive eating, it's recommended that you kind of stay between a 3 and a 7. So you don't get hungry to the point that you feel like you're going to pass out. But maybe you also don't eat, or maybe you eat a smaller meal if you feel like you're more on the full side. With all of this being said, as far as honoring your hunger, there are situations where patients may not have hunger cues, or they may feel more hungry all the time. Some of the situations that we think about, maybe not in the inborn error of metabolism world, is that like if you're sick, maybe you don't want to eat because you just don't feel well. Or if you're stressed, maybe you eat more because that's a way that you've learned to cope with stress. If a patient or someone can't rely on hunger cues, the general rule of thumb is to eat about every 4 hours, obviously while you're awake. And in the IEM community, obviously some patients, if they're on certain medical foods or certain medications, or they have a fatty acid oxidation defect where they've been told they need to eat regularly, or glycogen storage disorder, they've been told they need to eat regularly, they don't have those innate hunger cues. So again, there are, with intuitive eating and honoring your hunger, recognizing that maybe you can't recognize when you're hungry. So to have that safeguard in that if it's been 4 hours and your body isn't biologically hungry and you aren't experiencing the physical sensation of hunger, you may be just taking care of your body by having something to eat. The next principle is making peace with food, which I brought up when we were talking a little bit about psychological hunger. And making peace with food is pretty much giving yourself or a patient unrestricted permission to eat any food. Again, with inborn error of metabolism management, you may be thinking, oh my God, Stephanie, you're crazy. How are we going to give patients unrestricted permission to eat food, to eat any foods? And I'm not saying to go tell your PKU patients to go eat a steak. That is not what I'm saying at all. I'm saying that I think we need to shift how we talk about foods and talk about prohibitive foods, because there is a whole psychological component to eating. And it's normal whenever you tell someone, at least this is my experience, if someone were to tell me that I can't have something, the first thing that I want is that thing that I can't have. And I think we often see this in our patients when they hit adolescence and they are in school. I mean, if they can go to school, pre-COVID times, when they're in school and their parents aren't watching their backs, and all of a sudden they're trading foods with their friends for foods that they know they shouldn't have, but they've been told their whole life they can't have those foods. And so the second that they quote unquote are allowed, even though they're not allowed, but they have the freedom to make that decision, they're going to act on it. It's the same way that our minds work. Like if we were to go on a traditional type diet, as in this picture on the right, if you're told kind of on a diet that carbs are bad for you, maybe you didn't really want those carbs to begin with, but as soon as someone says, well, you can't have carbs because they're bad for you, you start thinking about them. So then you eventually eat that carb or that ice cream cone. And then you have guilt, you have shame, you have stress. And then you essentially rebound and you say, screw it, I'll eat whatever I want today and I'll be better tomorrow. This is a term called rebound eating. And I know in some of my patients, I've seen this where they've said, oh, well, I already ate too much protein. What's the harm in eating more today? And it goes into kind of that deprivation cycle, which you can kind of see here, that deprivation and guilt kind of go hand in hand. And so if we totally deprive ourselves of something and then you eat it, your guilt spikes, and then you go back into deprivation and this kind of whole cycle continues. And really the key to abolishing this pattern of rebound overeating is to give yourself unconditional permission to eat, and to really trust yourself that your body will know when it's hungry and what it's hungry for and what foods will nourish it. And so again, with making peace with food, again, it's not going in and saying that your patients can eat whatever they want, but it's shifting the language as we talk with families and patients about foods that are in their diet. And again, in my counseling of patients with inborn errors of metabolism that I've kind of practiced the intuitive eating principles, we've spoken about foods that they really view as bad. And obviously foods in the treatment of inborn errors of metabolism can be bad. They can be really harmful. And I found that in patients, especially in adolescents, when families have when a patient comes from a family where they kind of have this healthy relationship with food and the diet, and the family really, or the patient really understands their PKU management, that desire to eat kind of those bad foods isn't there, but the family also doesn't call those foods bad foods. They'll refer to them as foods that may hurt Johnny's brain. And again, I've seen this in the adult patients that I've kind of helped get healthier relationships with food, that as in adults, because they were always told, I can't have these foods, I can't have these foods, I can't have these foods are bad, these foods are bad. As soon as they were able to have the freedom in adolescence to eat those foods, they went wild. And then it turned into the cycle, not only of eating too much in general of overall health, but causing their Phe levels to go out of control, which then kind of caused the classic PKU cycle that we see in a lot of our patients. So shifting our terminology and having patients realize that the foods that they eat are to nourish them, and that there are foods that may not be optimal to them, but to have a healthier relationship with that is really important in intuitive eating and also in inborn errors of metabolism. So this is just an infographic from my friend Julie. She's actually who really inspired me to learn more about intuitive eating. And she is an intuitive eating counselor. So if you want more kind of insight for yourself, I highly recommend her page. But as far as making peace with food, I like this infographic because it really resonates into why we choose to eat things, and that there's lots of different reasons why we may choose to eat things. And just to kind of keep that in mind in the aspect of intuitive eating, because again, even with kind of treatment diets, we really need to kind of change our mentality and our counseling terminology of how we explain quote unquote good foods and bad foods. The fourth principle is challenging the food police. And I think that as dietitians, we automatically get called the food police, which I don't like at all. I think that generally as a dietitian, I don't know if any of you guys feel this way, but when you're out socially and someone asks what you do, sometimes the last thing that I want to tell them is that I'm a dietitian, because you get those stares of, well, now you're going to judge me for what I'm eating. And so this intuitive eating principle really resonates with me. And as I kind of said in Making Peace with Food, that part of challenging the food police is to recognize that no food behaviors mean that someone is doing good or bad. That kind of black and white thinking is not helpful in any way. And the goal of challenging the food police is changing the food reality by replacing kind of irrational thoughts with irrational thoughts with rational thoughts. And a big aspect of intuitive eating, which is kind of first presented in this principle, is this concept of compassionate self-awareness and avoiding negative self-talk. So getting out of the mindset of beating yourself up for making a food choice. And so in terms of the food police and kind of the different food languages, you can see here on the right the different food voices. So the food police and the nutrition informant are kind of the two food voices that can have that negative connotation. The food police is kind of that voice that is the diet rules. So, I mean, I grew up in a household personally that my mom was always on a diet. To this day, my mom is always on a diet, and she has all these rules like, oh, well, I had a bagel for breakfast, so I can only have a salad for lunch. And that's kind of a food rule. And I've learned kind of through my own intuitive eating journey, that rule is like that is a food rule and is an arbitrary food rule that, again, my mom, who has kind of been ingrained in diet culture, has pushed on me. And so recognizing that voice is there. But I've now learned to activate my food anthropologist and recognize, okay, if I had a bagel for breakfast and I want a sandwich for lunch, that's totally okay. And that's what my body's craving, and that's what my body needs. And then the nutrition informant is kind of the voice in anyone's head saying, well, I should eat this because this is what's healthier. And this nutrition informant, kind of as one goes through an intuitive eating journey, can kind of turn into a nutrition ally, because it's that voice of saying, well, this food may be healthier. It may kind of help one recognize, well, this food may nourish my body more than another food. So after I'm done eating it, I may feel better than if I chose a cookie. And the nutrition rebel is that voice that I see in a lot of our inborn errors of metabolism patients, which is the voice of autonomy, the one that wants to go against all diet rules. And it can really be self-destructive. So to kind of fight this diet rebel, thinking about how you can use those kind of angry actions to more productive behavior. And then the nurture is passionate voice that kind of says that this is part of a journey, and to recognize how you feel. And again, to have that compassionate self-awareness. So that compassionate self-awareness really comes from the nurture and the food anthropologist. And avoiding negative self-talk is really rejecting the food police, nutrition informant, and diet rebel. As a note, with inborn errors of metabolism and the food police, kind of how to extract this compassionate self-talk is really observe how patients think about food, how often, what their rules are, and how they feel about certain foods. It's in the inborn error metabolism world, all patients are going to have quote unquote food rules, and have kind of a food police in their head. But I think something that I kind of worked on, as I said, with some of the patients that I really recognized had disordered eating behaviors, was really having them rethink this thought process in their head about their relationship with food. So instead of their thought process of, well, I can't go on any dates because I can't eat anything while I'm out, which was what one of a patient told me, that was really struggling socially, is to kind of change those thoughts and say, okay, well, maybe you can't go out to eat with a date and share a chicken, but you can go out to eat and get a salad, or you can kind of adjust the protein in your day so that if you're out to eat and you want to have a cup of rice, that's still acceptable within your PKU management. So again, shifting the thought process. The next principle is discovering the satisfaction factor. And this really goes into what Meghan discussed at the beginning of her slides with being cognizant while we eat, and not eating mindlessly. So this is kind of that mindful factor with intuitive eating. And it is really a driving force in intuitive eating, because we can eat and we can eat to fullness, but we still may not be satisfied. And if you're not satisfied, you'll probably be looking for something else to eat or something to make one feel more satisfied. So making sure that the eating experience is satisfying is really crucial. And so some ways to assess satisfaction is by using these 5 questions of asking yourself, what do you really want to eat? What will satisfy me, quote unquote? Realizing that the pleasure of what you're eating. How does it taste? What does it smell like? What is the texture? What does it look like? How much is on the plate? All of these things kind of go into that satisfaction factor. And making eating enjoyable. So are you savoring the food? Are you paying attention to each bite? How does the food feel in your mouth? Again, these are more mindful eating principles, but go into our quote unquote satisfaction factor. And then recognizing in the eating experience when you may be full. That may not be when the plate is finished. It may be halfway through your meal. And then another concept is don't settle. Maybe you prepared something to eat and you realize after a few bites that that's not what you want. Realizing that it's okay, that maybe you order something else. Again, this is one of those principles that you should have food security. And then at the end or through your eating, ask yourself, does this food still taste good? Or am I done? Or do I want to try something else? And in order to harness the satisfaction factor, it is really important to be mindful and to be present while you're eating, not to be distracted with your phone or your email or anything else going on in the world. As far as the satisfaction factor, there's also the concept of feeling your fullness. And this goes into kind of conscious awareness eating, and that the amount of food that you eat may fluctuate with time. Some days you may eat a little bit more, some days you may eat a little bit less. And to kind of feel your fullness, it's important, if you go back to the satisfaction factor, to check in while you're eating and say, how do I feel? Am I full? Do I need to keep eating? And then if you happen to overeat, another part of feeling the fullness factor is to recognize that it's okay. That sometimes we want to eat because the food really tastes good, and maybe we're fully full, but we want to keep eating because, again, it tastes good and we want to finish the meal. Some things that may affect the fullness factor is the amount of time that passed since you last ate. So if you go 8 hours without eating, you're probably going to start your meal, if you remember back to the hunger scale, at a hunger level that's a little bit higher. So you may kind of overeat because that fullness or satiety feeling may not kick in until you've eaten too much. Another kind of aspect of the amount of time since you last ate, there's been a lot of research, and this was actually presented in the intuitive eating book in one of the slides, that nibblers, like so people that kind of snack throughout the day, will report less hunger when they're fed the same amount of calories as people that eat 3 times a day. So kind of eating more frequently creates this sense of fullness despite the caloric load of what is being eaten. And then the kind of food you eat. So we know that macronutrients play a role in how we may feel after a meal. Obviously, a very high fat meal is going to make us feel a little bit more full than for a longer period of time than something that's higher in sugar. And then the amount of food remaining in the stomach at the end of eating, your initial hunger level, and then also social influence. So something else to kind of think about with hunger is that when you're in a social situation and you're eating, you may eat a little bit more. Again, that's okay, and recognizing that's okay, but being mindful of these different factors that go into eating. The principle of coping with your emotions with kindness kind of goes into everything that we just said. You may have noticed that I kept saying that if you eat a little bit more, or maybe you eat something that may not have been the best for you, but it was what you were eating, not to feel guilty about it and to kind of recognize that it's all okay. So this kind of goes into being gentle and compassionate with yourself. But part of that is recognizing that eating is an emotional experience. And we kind of see that in every culture. So in every culture ever, food is part of celebrations. It's part of the mourning process. There's typically some sort of food component for every culture, again, for every stage of life. And I think it's something to point out that in the IEM world, something that I think sometimes gets taken away from families is this emotional eating, this emotional connection to food. And something that I've personally worked on with patients and their families is to adapt kind of some cultural meals to be friendly to an inborn error of metabolism condition. With that also being said, while there are emotional reasons to eat, sometimes we all will use food to cope with emotions that maybe we should seek a different avenue for. And part of coping with your emotions with kindness is recognizing that there may be times that you just want to eat a certain food to fit an emotion. Like I know for myself, whenever I feel really stressed, I really just want a chocolate chip cookie. And chocolate chip cookies make me feel better. And I know that about myself. And I recognize that that's just part of my mentality. And instead of fighting it and saying, well, I'm not going to have the chocolate chip cookie because it's quote unquote bad for me, I'm going to eat the chocolate chip cookie. And I'm going to recognize that that chocolate chip cookie gives me gratification. And maybe it does help me cope with my emotions. And maybe I could find a different way to cope with my emotions, but I recognize that it's really okay. That's an okay thing for me to do. So whenever we have emotions, in the intuitive eating book, it's recommended that we kind of walk through our emotions and our desire to eat with emotions with these typical or with these questions. And so the first question is, am I biologically hungry? So if you're hungry, definitely eat. There's no reason not to. And then what am I feeling? Are you feeling sad? Are you feeling happy? Are you feeling stressed? Are you anxious? Again, what is the feelings that you're associated with? And then what do you need? Do you need to eat? Like I said, when I feel stressed, I always feel a need to eat a chocolate chip cookie. And I've just recognized that that's just part of me. But if I felt sad, do I need to eat something else or do I need a hug? And then another concept is asking for help. Having a supportive community around you is really important for anyone. And so asking a colleague or a family member or a friend to help you with an emotion. And then also learning how to meet your needs without food. Do you need to rest? Do you need to go for a walk? Do you need to meditate? And then also deal with your feelings. So if you notice that you're always turning to food whenever you're sad and you're not dealing with what's causing that sadness, really working on figuring out what is causing that sadness. And then also seeking a different distractor. So if you use food as a distraction from feeling your feelings, find something else for that journey. We're running out of time. So respecting your body. This is a principle that Meghan has already kind of spoken about. In terms of inborn errors of metabolism, part of respecting one's body is respecting the fact that patients have a chronic condition, and reframe the chronic condition as having an additional set of needs that need to be satisfied. So again, in intuitive eating, kind of respecting your body has taken on this persona of health at every size and body positivity and weight inclusivity. But another aspect of it is respecting your body, and recognizing that a patient does have a chronic condition and respecting that chronic condition and what the needs are to treat that chronic condition. I just also want to say, with respecting your body, as healthcare practitioners, I really encourage you to assess your own maybe weight biases. This is something that I've recognized, that I definitely had an implicit weight bias, and that I've worked towards shifting. So always remember that we live in a fat phobic culture, and just because a patient is overweight or obese does not necessarily make them unhealthy. Health is not measured based off of weight. The health at every size principle has pretty much shown that the pursuit of health does not involve weight loss and really can be achieved at any body size or shape. And it's been shown that when patients have weight inclusive, or kind of are approached by health at every size, that there actually is an improvement in a lot of health outcomes. So I know that there's a lot of conversations about patients with inborn errors of metabolism that are overweight or obese, and that they need to lose weight. I really encourage you to shift your thinking. If a patient expresses a desire to lose weight, then that's something that you can definitely work with. And I'm not saying that no patient should lose weight because of health at every size. If a patient has a desire to lose weight, there's definitely ways that they can achieve that. I would encourage you to see why they want to lose weight, but just remember that health can be achieved regardless of body size. And encouraging patients to be active, and to honor their bodies with gentle nutrition is a lot better way to achieve health than necessarily putting them on a yo-yo weight loss diet. With that, also, moving our bodies is super important. This is one of my favorite things, but it's also important to move your body healthfully and to recognize the importance of rest. This is something that, again, personally I've worked on, and making activity just a daily or part of your daily life, and not associating exercise or fitness with weight loss. Exercise and fitness should be associated with making your body feel the best that it can. When we move our bodies, we definitely feel better. We feel stronger. We have more energy. We're able to sleep better. Our patients experience the same thing. And patients should be encouraged to move and be active. And with pretty much every inborn errors of metabolism, there is a way to safely encourage movement and activity. With that also being said, making sure that movement is healthy and safe, and that patients aren't becoming obsessed with exercise kind of from a weight loss mindset. And this intuitive exercise decision tree is something that I really like to focus on, because sometimes what our bodies what our body needs is rest and not movement, and being able to kind of recognize that combination. And the last principle is honoring your health with gentle nutrition. So there's a variety, moderation, and balance is key. So making sure that one's eating enough, that there's plenty of whole grains, fruits, and vegetables, making sure that there's protein. Obviously, with patients with inborn errors of metabolism, this will likely be a medical food, carbohydrates, and fat for satiety. That there is an appreciation for quote unquote play foods, and patients are eating what they want to eat. I have found that the simplified diet has been really helpful for patients to be able to explore this gentle approach to nutrition within the inborn error of metabolism community, because there's such an availability of fruits and vegetables they can eat without thinking, well, I have to count the protein or the fee from this food. They know that these foods are available for them to eat and to enjoy. With that being said, I don't know, my animation did not work. So, guys, I'm sorry. I will just read this for you. As far as the principles with intuitive eating and inborn errors of metabolism, again, much of this I mentioned, in that with the first principle, IEM patients, we're not asking them to reject their dietary treatment. It's rejecting diet culture. In honoring hunger, patients with inborn errors of metabolism may not be able to recognize hunger, so it may be advisable to ask them to eat every few hours. As far as making peace with food, in our counseling, we can adjust our language and prevent that deprivation cycle from occurring. In challenging the food process, we can teach our patients to compassionately self-care. And then in discovering the satisfaction factor, finding foods that are appropriate for a patient with an inborn error of metabolism to feel satisfied. In respecting your fullness, IEM patients, I can't read my notes for this one, sorry guys. IEM patients can be in tune with how they feel while they're eating, and can practice conscious awareness eating. And then coping with emotions with kindness. I think that this is really important with patients with IEMs, to help them prevent emotional eating, because emotional eating can be really harmful for them if they start kind of a binge cycle that pushes them outside of whatever their protein tolerance or their fat tolerance may be. And respecting your body, again, recognizing that having an IEM is part of one's body and one's health journey, and also respecting their actual physical body and not trying to conform with the social kind of norms of what society tells us bodies should look like. As far as movement, IEM patients should move, but they may need to be mindful of adjusting intake before and after an exercise session. And as far as gentle nutrition, IEM patients can also eat a variety of foods that promote gentle nutrition, and also to be mindful that certain nutritions may be supplied by medical foods. As I said, the simplified diet has really helped at least some of my patients explore intuitive eating. And I know in the paper, one of the papers by Lori Bernstein, one of the positive aspects of patients that were surveyed on the simplified diet was that they expressed that they had more freedom to enjoy more foods. The simplified diet may allow for principle 2. So if a patient is hungry, having a option of foods to eat that may not push them out of their protein range. If they're, as far as making peace with food, that there's less restriction on foods that may be available and that it may lower their feelings of deprivation. And then 10, having a variety of fruits and vegetables leads to more gentle nutrition. As promised, here are kind of some intuitive eating resources. So the first are all podcasts that you can listen to on your, well, you drive to work still, on your drive to work. Here are some Instagram accounts that I find helpful, and then books, if you're interested in intuitive eating. Again, the intuitive eating book is an excellent resource that I really encourage all dietitians to read. Anti-Diet, which is by Christy Harrison, goes kind of challenges one's view of diet culture in general. And then Health at Every Size is a book by Lindo Bacon regarding the health at every size movement, and really explains the science that our health is not attached to a number on the scale. With that being said, any questions? I think I went over a little bit on time, so I apologize for that. I see 2 questions. So can you share ways to approach intuitive eating with IEM during appointments without insinuating that they have an eating disorder or disordered eating? I know that can be a touchy subject. It is a touchy subject. I currently have an adolescent patient that I think has an eating disorder or disordered eating. And so I think it really depends on your relationship with the family, and your comfort level. Something that I strongly recommend is having a therapist available. I know that not every my center does not have a psychologist, but I happen to have colleagues in my area that are therapists that I have referred patients to a few times to kind of help be a bridge. But other things, like kind of ways that I've explored patients' relationship with food, is just by asking some basic questions, kind of, how does eating this sort of food make you feel? Or how does kind of I sometimes ask my PKU patients, what does it mean for you to have PKU? How does it make you feel? And to kind of explore their relationship with their condition and then their food limitations. But again, if you really think that a patient does have an eating disorder or disordered eating, I really recommend working with a counselor or a therapist. Another question, what are some suggestions for pediatric/kids to teach them to honor their hunger when they have to eat a certain amount of protein or formula? So it's tricky, and that's kind of one of the caveats of intuitive eating and IEMs, is that patients may not be able to honor their hunger. And if they have a certain amount of formula or food that they have to get in, and they may say that they're not hungry, something that I have explored is kind of using different formulas, maybe not using a complete formula, but more of like kind of the protein modular formulas that may not have that as big of a feeling of satiety, to again help them have a more natural relationship with food. And how do you integrate intuitive eating in an acute care or subacute setting? Like as far as in the hospital, I don't think that you can. I think that intuitive eating and applying this approach really takes on a counseling perspective and having kind of a long-term relationship with a patient. So if it's just in a kind of inpatient hospital setting, I think that there are definitely barriers to being able to apply the intuitive eating principles. That's just my view. I don't know if there have been any studies on intuitive eating kind of in a hospital situation. but I have not used it for any of my patients that have been admitted. Again, it's more something that I've used with my long-term patients that I see all the time. Any other questions?
I don't see any, but thank you, Stephanie, for that awesome review. Just everyone be on the lookout for me with an email with your certificate of participation. And I'm so happy we got to do this today. Stephanie, thank you so much. And I really hope that you all reach out to her with your questions, follow those accounts, take a look at the resources. I learned so much about this population and their specific needs. So thank you so much.
And we can leave the slides up, or the slide up if you guys want, so that you can write down those resources. And please email me if you guys have any questions. I'm on the listserv. My email was on the first slide. Oh,
yep, there we go.
There you go.
Awesome.
All
right. And everyone, you will also be getting a copy of the slides. So I'll be sharing those resources too. So don't worry too much about grabbing them. All right. And with that, we're going to end the webinar. Thanks everyone so much for coming. I saw we had a lot of participants. So have a great rest of your night, and we'll hopefully do another one of these soon.